After my last video on ergonomics in the operatory and stretches between patients, I got a lot of emails and responses, and many of you wanted to share your own tips and tricks with me. I even got a few calls from friends, including this one by Dr. Vafaie, who's one of our RWE faculty practicing in San Francisco. Like many dentists, Nader has experienced occasional lower back pains and so on, and has developed a program of stretching and exercises that he recommends between patients and even at home after patients. So let me demonstrate a couple of these exercises that he shared with me that are helpful to the upper body in the neck and the shoulder area, as well as the lower back area.
All right, so the first one I'm sure most dentists will complain about is their neck. Of course, the neck and shoulder are intimately related. If you have neck pain, often the shoulders are not working well. So you often hear dentists having neck, shoulder issues. And of course, the main reason is because we're rotated to the left and often down. And if we're really good, we're sitting neutral and looking down, but we're still in a static position, kind of holding our neck down. And often, if we're looking directly into the oral cavity, we're kind of rotating down and in for direct vision. Or for endodontists, we're using scopes, so we're kind of seated straight, but we're still holding static tension and positions in our neck and shoulder. So the first stretch really covers the neck and shoulder complex, and they're intimately related, like I talked about. Often if your neck is feeling pain in the bottom cervical areas, that'll translate to the shoulder and often sometimes down to the arm. You'll hear dentists having arthritis, tennis elbow, carpal tunnel issues, just chronic problems. Those are all related to how the neck and the shoulder function together. So the first stretch will cover that. So let me cover that with you. Let's see if I can position myself. So you're going to and do these several times a day. It helps. The more you do it, the better. So you're going to take your hand in this position and put it directly behind your back in the same position with the palms down. You are going to then turn your head to the right, and you're going to feel a little bit of tension between your scapula and the neck and the shoulder. And don't worry about the pain, that's very normal. Hold that pain and breathe into the pain. As you guys have heard, breathing into pain or breathing into the stretch helps. And that really has helped me. Don't be afraid of stretching into pain. And so hold that position for about 30 seconds or so. When you come back to normal, you're going to rotate your head back first and then bring your arm back out. Okay, so like that. To take the stretch even further, you're going to do the same thing. Bring your arm palm down with your shoulder blade way back and look to the right. And this time I'm going to look upward and hold that for about 30 seconds. And you're probably going to feel this go down to your mid back and low back. And then same thing, you're going to come back down, turn your head, arm back out. So that's the neck stretch, neck and shoulder stretch. And it's really been helpful. Along the same lines, often when we're kind of turned and rotated, what happens is the scapula gets stuck to the rib cage because we're turning and we're in. A lot of times we're in, we're not standing in a normal neutral position where our scapula can be outward. And so it's really important for the scapula to be away from the rib cage as much as we can. And you'll see people that kind of have the slouching forward phenomena. What happens is the scapula gets pressed into the rib cage and there's no motion in the scapula. And no motion in the scapula usually amounts to a lot of problems in your latissimus muscles, the lats, and also the serratus muscles that are underneath it. That's often where a lot of the shoulder pain down here or I should say mid back or scapular pain, which we all have, comes from, is because the scapula is kind of stuck to the rib cage. The lats compensate, and so does the serratus muscles. what I like for that is basically to take your arm, let's see if I can get this over here, arm over your head and pull upward on your elbow joint, or I mean on your shoulder joint, with the direction going this way. So you're going to kind of stretch. Here's normal, and here is a stretch where you're pulling your shoulder blade upward toward the ceiling. And hold that for about 10 or 15 seconds, and back down. And you'll probably feel a big release with that. You want to be able to release your lat and serratus muscles, and be very conscious during the day to have your shoulder blades, your scapula, away from your rib cage. So you want to, normal is here, you want to kind of push them back. You want to be able to push your scapula back while you're releasing, or while you're relaxing your shoulder blades, or your shoulders. You don't want to tense your shoulders to push the shoulder blade back. You want to kind of have relaxed shoulders, but have your blade to be back. And low back pain in particular, and that's usually resulting from the psoas tension or lack of release, like we talked about. And so let me show you how this stretch goes. I'm going to show you my foot position first, and that's quite important. So the foot position is like this. So you're going to have your one foot, kind of, I hope you guys can see this, pointing directly in line with your shoulder, or with your leg. And you're going to have the other foot at 90 degrees to that other foot. And you want your heels to be in line. So my heels are in line, and I'm kind of at 90 degrees toward each other, okay? So 90 degrees, and you're probably gonna feel a little bit of tension through this leg, whichever side you're having pain on. You're going to then turn your pelvis to that leg that's pointing the other way, and go down. And you're going to kind of drop this arm, and you're going to try to just gently hug your leg with this arm, or the same side. Scoot in here. There we go, kind of like that. So your pelvis is turned. I'm looking directly that way, and this arm is dangling, and you want to basically keep this leg straight and force your hip to go the other way. So you're counterbalancing your hip joint. And hold this for 30 seconds or so. And then when you come back up, you're going to come back, and do not go straight. You want to come back in the same position. So you want to come back this way, back straight up, and then come back to neutral. Repeat for the other side. So let's do the other side. Kind of 90 degree, you can see that. Turn and face. You're going to reach down on this side, let your arms dangle, and let this side kind of grab your ankles. Let this leg be as straight as possible, and anti-rotate your pelvis the other way. And hold that. That one is feeling really good for me. So I'm going to hold that for a second. And you may feel kind of like your sacrum or low back kind of start to pop and move around. That's a good thing. It's releasing tension. And come back up and back to neutral again. Take a few deep breaths, ground yourself, and you're good to go. And of course, a variation of that is I like having my legs kind of far apart. Scoot back here, it's hard video to shoot, and coming straight down. And touching the ground, holding that. And coming back up. And you can do that a few times. Going down, touching the ground. It may be hard at first for those of us that aren't flexible, to do this, but you should be able to get it after a few times and go back up.
You also may want to consider additional support, such as a weight belt, as recommended by Dr. James Ho, an endodontist also practicing in San Francisco. These help support your core. You can also use a full posture support belt and strap like this one that allows you to have both a better core support, like a weight belt, and also some shoulder and neck support with the upper straps. But I'm not really crazy about this one, as this does hamper your mobility. But before you get used to wearing these supports around your abs and shoulders, you should also know that you can get used to them. And if you do wear them chronically and not exercise your own muscles while wearing these adjuncts, these tools will actually result into muscle atrophy. So be aware of this, and if you do wear them, make sure that you continue to exercise and maintain core muscle strength on top of these supports. As our TB12, past Patriots 6-time Super Bowl champion Tom Brady says, your longevity in the game is a function of your muscle strength and your muscle length. Stretching exercises along with good nutrition are important factors for your longevity. And that is true also for you healthcare providers in the field and you young dentists trying to practice dentistry. So understand that you have to chronically do muscle strengthening and muscle stretching exercises throughout your day and for your entire career. Think of it as the fuel of your clinical practice, and for those younger dentists, the secret to a long career. In fact, to all of you surgeons and healthcare providers out there taking care of people's bodies, remember to respect your own body along this journey. It's the most important tool you have through which you practice your art. Stay healthy, and let's save some teeth.